Thank you, and welcome to What You Need to Know About Drink Spiking and Sexual Assault. And so, if you're joining us today, thank you for being here. This is something that is very important to our organizations as it is Sexual Assault Awareness Month. DCFNE, KnoNap and KnoMore all care very much. We have a shared interest in sexual assault and drink spiking and reducing both of those. So, we're going to talk a little bit about that today, and we welcome folks' engagement. Just a quick content warning. We will be talking about sexual assault and drink spiking, and we understand that these conversations might be challenging or difficult. So we encourage self-care and awareness of your limitations. If you need a break, feel free to pause or step away. That being said, I'm Erin from the DC Forensic Nurse Examiners. We're a nonprofit organization in Washington, D.C. that provides free and confidential care to sexual assault survivors and domestic violence survivors.
Hi, my name's Veronica Schmalfus. I'm the Media Marketing and Outreach Manager here at KnoNap. KnoNap is a company that works to empower, educate, and advocate against drink spiking, one empowerment tool and educational tool at a time. We've created tests and physical barriers of protection to empower anyone during their nights out.
My name is Danya, and I am the executive director of KnoMore. And KnoMore is a nonprofit organization that provides tangible resources and educational tools to communities to empower people to best combat drink spiking and drug facilitated crime.
We'll start by, quickly defining what is DFSA or drug facilitated sexual assault. And so when you hear us say DFSA, we're referring to drug facilitated sexual assault. And that's when drugs or alcohol are used to impair a person's ability to consent to sexual activity or to resist any unwanted advances. And so that can happen in a variety of ways. And so, you might have heard of it or be familiar with the term when a perpetrator might secretly give drugs or alcohol to someone without their knowledge in order to facilitate an assault. But we also know, especially in the forensic nursing realm, that it also can happen when a person voluntarily consumes drugs or alcohol that render them unconscious and unable to consent. So, overall, what we know is that people who are intoxicated or unconscious cannot consent to sexual activity. That includes all forms of sexual contact, so kissing, groping, oral or anal sex, vaginal sexual intercourse, or penetrative intercourse. In our experience at DCFNE, it is common for us to have patients who are coming in seeking care either with or without memory of what happened. And so either they remember being assaulted or maybe they have some type of amnesia and suspect that something has happened to them.
I often get asked by individuals, Erin, who suspect that they've been drugged, what should they do, especially in those moments? And with your expertise, what would you recommend are the best next steps?
Thank you so much for asking. We know that it's a very deeply personal decision for survivors what they choose to do after an assault or suspected assault. We support them in making whatever decision is going to be best for their health and safety. In many jurisdictions, including Washington, D.C., people who've experienced DFSA or drug facilitated sexual assault have the right to access a free medical forensic exam. So that would be the specialized services from a forensic nurse. And that is required even if they're choosing not to report what happened to law enforcement. They're not required to engage in the legal process in order to get that specialized care.
That's amazing. Could you maybe talk a little bit about what happens during a medical forensic exam?
Of course, of course. And the short answer is whatever the patient consents to happening. We try to be very consent focused and trauma informed when we're providing our options for care. And so, a medical forensic exam, it's that specialized care by a nurse who tailors it to the needs of someone who's experienced violence. And those needs, as I kind of mentioned, they can vary based on on what the patient's priorities are. So it can include a physical assessment for medical needs. It can include documenting and treating injuries, including potentially taking photographs of any injuries or findings. It can include offering medications that might prevent sexually transmitted infections, emergency contraception to prevent unwanted pregnancy after sexual assault. It can include connection with a variety of support services, so legal, housing, counseling, advocacy support, which our program works in partnership with. One of the things that we also do is, we're specialized in collection and preservation of evidence. And so what that means is that we're able to collect specimens, such as a sexual assault kit, or in Washington, D.C., we call it a PERC, a physical evidence recovery kit. And we're able to collect specimens that might later become evidence. And we're able to do that in a way such that it could later be used if a person engages in the legal system. Couple quick notes about the sexual assault kit. We collect those up to 5 days or 120 hours after an assault happens. We offer that whether or not the patient wants to report to law enforcement. If they don't report to law enforcement, we'll store it internally for a period of time. If they do report to law enforcement, we'll transfer it right over to the appropriate agency for testing. And one of the tests that we can actually conduct from the specimens is toxicology testing.
Can you please elaborate on what is toxicology screenings and testings and why a survivor may want to receive that?
Absolutely. And that's, particularly relevant to our conversation today. Any patient of ours who has described a loss of consciousness or other symptoms that might be consistent with DFSA, loss of consciousness, nausea, consumption of drugs or alcohol, those patients will, based on their circumstances, they'll be offered to have the toxicology panel samples collected, and that will include blood or urine sample that's sent for testing. The point of those toxicology panel tests is to determine if there's like any unexpected substances in the patient's blood or urine. So, is there anything that might have caused them to become unable to consent? We're able to take blood samples up to 24 hours, and we're able to take urine samples up to the 120 hours. So same time frame that we're collecting that evidence kit, if that is something the patient wants. In the District of Columbia, we're having those specimens tested by the Department of Forensic Sciences, which is available for folks whether they're reporting or not reporting to law enforcement. And it's about a 90-day turnaround because it's a very comprehensive testing panel. Hundreds of substances are tested for. The toxicology test really relies on, what the patient says that they experienced so that they can know what substances to look for. So very broad testing. We do find that a lot of the time survivors who might have been on the fence about whether they want to report or not, these type of tests might give them some clarity in making a decision once they find if there's been any substances in their blood or urine. But, one caveat being that the amount of time the drugs last in the system really depends on folks' metabolism. So we always tell our patients that just because a toxicology screening came back negative, it doesn't mean that something didn't happen to the patient. We're very sure to include that education when we're offering those tests.
Yeah, thank you so much for talking about the details of what happens during the forensic medical exams and a little bit more about the toxicology screening. Could you maybe give us a little more detail on who specifically provides those forensic medical exams?
Of course, yeah. So the forensic medical exams are provided by our organization, DCFNE. So our nurses provide the forensic nursing response for sexual assault and domestic violence for all adult survivors in Washington, D.C. And then we're one of two agencies that does this care for adolescent survivors, so ages 13 to 18 years old. In addition to the medical care, we're also collecting the specimens, doing the documentation, and that, as I think I touched on earlier, can be made available to investigators or attorneys if a person is engaged in the legal system at a later point.
And how would you say a survivor is able to access a forensic medical exam?
Well, we're available around the clock. So that we always say that there's kind of two golden broad access ways to get in touch with us 24/7 around the clock. The first would be that we have a 24/7 on call response out of the MedStar Washington Hospital Center Emergency Department. So folks don't need an appointment. They can show up in the emergency department and the forensic nurse will be dispatched and will arrive within 1 hour. Alternatively, if folks just want to hear their options or be connected to an advocate, maybe they're not sure of what decision they want to make, they can also get in touch with us or get in touch with an advocate by calling the DC Victim Hotline, which is available for victims of all crimes. And that number is 844-443-5732. And the acronym to remember that is 844-4HELP DC. Those are kind of the easy ways to get in touch with us. But now that you've heard a little bit about the medical side of things, let me pass it off to Danya at KnoMore to talk a little bit more about the problem of drink spiking in specific.
What I would like to say is, as far as this conversation, the way that we define drink spiking is when someone puts a substance into another person's drink without that individual's knowledge and or consent.
How prevalent do you think that drink spiking is?
Such a good question. And the prevalence of drink spiking is very hard to statistically point out because there are issues associated with the rates of reporting. It's estimated that around 90% of individuals who suspect that they've been drugged do not report their experience with law enforcement or medical providers. And to no fault of those individuals by any means, it's hard to even report sexual violence, and especially with the drug facilitated component where someone may not remember where they were, who they were with in the events. It's incredibly hard. There are some studies that have been done that estimate around 1 in 13 college aged individuals suspect that they've been drugged with a drink. But we also did within this past year a educational session on a top 10 public universities campus within a statistically significant sample size and found 77% of the individuals in attendance self-reported that either they had been drugged or knew someone that had been drugged. And this very much highlights the importance of the education work as well as the empowerment resources that are necessary to empower individuals in social settings to be aware to combat drink spiking.
I think we find in our experience that a lot of our patients, they're minimizing their own risk for sexual assault in general. So, can you clarify like who's actually at risk for drink spiking?
Such a good question, too. Thank you for that. What I would say is the narratives around drink spiking are that of women being drugged and assaulted and men being drugged and robbed. But in all sincerity and seriousness, anyone can be affected by drink spiking, regardless of someone's age, gender, sexual orientation, and geographic location. High prevalence groups that drink spiking has been reported amongst include anyone that goes to bars, clubs, house parties, raves, restaurants, anywhere where there are beverages. Any beverage can be drugged, alcoholic and not alcoholic, all the way down to water and or ice. And so individuals, especially women in their late teens and 20s, have reported drink spiking more frequently than other demographics, but there is still high prevalence rates amongst anyone who drinks and socializes in social settings, which is why these conversations are important for everyone to be aware of and involved in, even if at the level of being an informed bystander.
We briefly just touched upon the where, and we definitely discussed the who. Could we talk a little bit more in detail about where drink spiking most frequently happens?
Absolutely. So, as unsatisfying as an answer as this is, drink spiking can really happen anywhere. And anywhere, oftentimes, that there are socializing people that are familiar with one another as well as people that are not. It's estimated around 80% of assaults occur between two people that know one another. And so, it's just making sure you're aware of your surroundings and knowing that this is something that can affect literally anyone.
In your experience, what kind of drugs are folks using to spike drinks?
Yeah, so specifically to spike drinks, the common drugs that people most associate with drink spiking include benzodiazepines. That's the Rohypnol, roofies. Roofies is often colloquially known as the date rape drug that people classify all under, but Rohypnol is actually a benzodiazepine. GHB as well as ketamine are common drugs listed and statistically reported in association with drink spiking. However, I'll also say drugs of abuse come in multiple form factors, including powder, liquid, gel, and these substances are illicit drugs. They're drugs that are prescription drugs that have incredible usage for individuals that use them properly and for their own personal care. But unfortunately, especially with prescription rates as they are in urban settings and on and around college campuses, these drugs have the potential to be exploited. And especially in consumption alongside alcohol, these substances, as well as benzodiazepines, ketamine, GHB, and more, can be utilized for exploitation.
If a drug is put into your drink, if any, are there any physical indications in your drink?
Yeah, again, a not satisfying answer for you. Oftentimes, you cannot even tell that something has been added into your drink. I have heard that individuals look for a fizziness, a color change, a salty flavor, a notification of if your ice is sinking, that means drug presence. And I'll clarify here, absolutely no. The instance of looking at ice in your drink if it's sank is not true. Sometimes there may not even be visual indications of drink spiking, including that fizziness, the color change, right? And what we say is looking for those is not the greatest example of how you can best empower yourself. If there's ever anything that you are drinking a beverage and it tastes different than what you expect, it feels different, something feels off, get rid of the drink. And those are one of the greatest indications. Don't look for indications, right? But just be aware and informed.
And I can say, from yeah, I have clinical experience about some symptoms that folks might experience from drink spiking. But how about in your experience doing this work? What symptoms have you heard from survivors or others doing this work?
Symptomologies we've heard associated with drink spiking varies greatly by what the drug is utilized and the exploited drug is put within. They symptoms that we often hear are those that are associated with the effects of voluntary drinking or drug use. We often hear, to your point, Aaron, earlier narratives of someone having dizziness, confusion, loss of consciousness, nausea, vomiting, and disassociation, all symptoms that could be associated with heavy drinking. And so, what we say are amongst the best ways of knowing if a beverage has been drugged is to know yourself, know the rate of consumption that you're at, if that aligns with what your body's expectation and results are, and to just be an informed individual in social settings. That means knowing your awareness, being able to cover drinks, test drinks, but also just being aware.
Outside of the seriousness of the physical symptoms that can be experienced from drink spiking, why else is drink spiking an issue?
Yeah, drink spiking is a massive issue as it relates to health concerns, being aware and capable of having autonomy over your body, crime risks. of the narrative again of women being drugged and assaulted and men being drugged and robbed. But really, these issues can affect anyone, regardless of their gender or sexual orientation. And along, there is a correlation between drink spiking and drug facilitated sexual assault and crime. So at this point, I'd love to pass it back to Erin to really just get to talk about how does drug facilitated sexual assault relate to drink spiking?
Of course. And you put it, very well, point blank, right? That drink spiking can be that precursor to drug facilitated sexual assault, which is a crime, right? But we also know that not all drug facilitated sexual assault involves drink spiking, right? We talked about times when folks might have voluntarily ingested substances. Maybe they had a drug interaction with substances that they are known to take. Also, food can be spiked, not just drinks. So there's kind of a variety of ways that this might manifest.
So, if drink spiking and drug facilitated sexual assault are so common, why does it go underreported so frequently?
Well, I mean, I think that we've spoken a little bit to this already, but it bears repeating that sometimes too much time has passed for a toxicology specimen to show the presence of certain drugs. So, because of that, there is not always the most conclusive data on how often folks are reporting because we don't have those answers. We also know that alcohol is a common drug that is used to spike drinks. So even if a toxicology panel comes back negative, for example, if a person unknowingly consumes more alcohol than they intended to do. That's another form of non consensual drink spiking. And, we talked about, maybe someone did consent to consuming that alcohol or that illicit substance. In our experience at DCFNE, many of our patients are fearful or hesitant to report if they were potentially drugged or if they were drugged because of shame or embarrassment or self blame. We see this showing up a lot for our patients. And we always just want to share with our survivors that, you're not to blame if you experience this. If you experience drug facilitated sexual assault, and just continuing to uplift that if you're intoxicated or if you're unconscious, you can't consent to sexual activity, and you deserve to be able to go out and make your own decisions, whether that includes drinking or using street drugs, and still not get harmed. You deserve that. So we try to validate that with all our patients. Bottom line, survivors are never to blame for their assault. But that being said, I know that you all have some potential ways that folks might use to feel safe and empowered to combat drink spiking, right? We're never putting the onus on them to prevent their own assault, but there are things that folks could maybe use to feel more empowered. So I'd love if you would share with the audience about that.
Thank you so much for your handoff on that. KnoNap has created certain empowerment tools, like you said, to help people feel more comfortable on their nights out. We've created a test and also a barrier of protection or a reusable cover for people to bring with them or for bars to provide in order for them to feel safer. So our test actually runs in 3 to 5 minutes. It's a single use test and it can test for 12 drugs that are typically used to spike drinks. And our cover is actually reusable, which is super cool. It's made of a soft plastic and can stretch over multiple different beverage containers, including tumblers and the size and shape of red solo cups. But there are also a lot of other physical tools out there. There are single use covers, there are color changing tests. Our test has 3 lines if you have not been drugged, or 1 or 2 lines, whereas other ones can change different colors if there are drugs detected or not. And so there's an abundance of options for people that want to feel safer on their nights out. And I think that there are also a lot of options if people are not willing to purchase physical tools, or if they don't have access to these physical tools, that they can still stay safe on their nights out. Danya, would you like to take that away?
I would love to, and thank you for the clarification information about KnoNap's resources. What I would love to share is as part of Know More, our goal has been to always make sure that we're supporting community members and overall public health. And at the end of the day, it's our personal belief that empowerment should not be cost prohibitive. So if anyone is or an organization's interested in receiving resources for their members, please reach out to us through Know More, and we're able to support our community health partners. Beyond the tangible resources, there are many safe drinking practices that someone can do to empower themselves against drink spiking. And that includes the physical protection tools like the note test, note covers, but then also avoiding communal drinks and bringing your own drinks or closed containers as much as possible. That's why the note cover was designed to make closed containers from open containers. Not accepting drinks if you're not able to see them being made, right? And what we like to say is it's important for people to stay in the know. So KNO, meaning that you're keeping your drink in sight, you're noticing any odd behavior, which means you're just being a good bystander, and then also observing your drink being made, discarding any unattended drinks or drinks that you suspect could be tampered, watching drinks, you're able to cover, test, and just make sure you're keeping your beverages with you as far as safe drinking practices.
Thank you. Thank you. And, we know that even with the best intentions and the utmost precautions, an assault can still happen. So, what should somebody do if they suspect that they were drugged?
That is a really, really great question. Thank you. So, if you suspect that you've consumed a drink that has been tampered with, we really recommend that you reach out to someone that is not on the premise, as there have been several cases of drink spiking that have occurred from the bartenders or by someone that's in your group. And so if you reach out to someone that's already on the premise, there is a possibility that you could be telling the person that did spike your drink. Outside of that, we do recommend that you inform some sort of security or a manager that's on the premise or local law enforcement to potentially help you exit the environment that you are in and make it home safely. We very, very much don't recommend that you leave the bar alone or walk home alone, especially if you think that you've already consumed a drugged drink.
And I would just love to add that, as the medical provider here or professional here rather, we always say that if you suspect that you've been drugged, to trust your instincts, right? We want patients to feel empowered to seek medical attention. Even if they don't feel like they're experiencing severe symptoms, like we know our patients are sometimes minimizing their experiences, but just uplifting, right? You have the right to be safe, to be cared for, to preserve any potential evidence, even if you're unsure about what exactly happened. And just in my experience doing this work for many years, I've encountered a lot of patients who have said, that they weren't ready to seek medical attention, and that's okay, right? But we encourage those folks that if you're not having what you perceive to be a medical emergency at the time and you're not ready to seek medical attention, you should stay with somebody that you trust. You should try to avoid consuming any additional substances, and potentially write down what you remember. For us, your safety matters most. So want you to listen to your body, protect your safety, and know that you can choose to get help, and the forensic nurses will support you at any time that you choose to seek that help.
Thank you so much for adding that. That is super important. Along with that, other resources that are available to you, KnoNap and KnoMore have actually collaborated with local law enforcement to bring you kind of a guide as to what to do in a variety of scenarios, including if you suspect that your drink has been drugged, if you get back a positive note test, if you are being harassed at all, and we can provide the link to that below in the comments.
And it's an incredible resource as far as our What Now campaign to address not just the moments of in the moment of consumption, during, before, during consumption, and following to really make sure that, to Erin's point, everyone deserves to feel comfortable and safe. And we are all for better times, better vibes, and better imbibes. No, and I appreciate this conversation so much because oftentimes we at at Know More and Know Nap work on a prevention, making sure that people have the empowerment education resources, and that's why community health partners like DCFNE, who are on the post side supporting survivors, the work that you all do in your team is invaluable and incredible to the community. So as part of Sexual Assault Awareness Month and year round, I just want to take a moment to appreciate the work that you're doing to support the DC community. So thank you.
Thank you. I would say, it certainly takes a village, and we need folks on the response side as well as the prevention side. We're never going to end sexual violence. Just one person's not going to do it, right? So for us, working together and having people with a shared mission is so important to find like-minded individuals.
Absolutely. And so at this point, I would just like to say thank you guys so much for joining and learning more about drink spiking and sexual violence. If you'd like to learn more about No More and No Nap's work in combating drink spiking, please feel free to visit our websites at knonap.com. That's just KNONAP.com, as well as knowmore.org. That's KNOMORE.org. And I will sign off with say nope to drink spiking. Erin, where can we learn more about forensic nursing and forensic nurses exams, as well as DCFNE's information?
At DCFNE, we're available on all socials at DCFNE. We're also at www.dcfne.org. And just a reminder of what I shared earlier, if folks need to access services in Washington, D.C., we have 24/7 response via walk-in at MedStar Washington Hospital Center or through the DC Victim Hotline, which is 844-4HELP-DC. Thank you all.
Awesome. Well, thank you guys so much and stay safe against drug facilitated sexual assault and crime. Thank you so much for your time.
Thank you.